Okay, good. All right. Tell me when you're ready. Okay. Hey, good morning, everybody. Thank you for joining us. Appreciate you making time to be here. This is just to update you on what we've done this week and what our plans are for the future. I want to start by with an announcement that Alabama is going to expand its eligibility for COVID-19 vaccination beginning March 22nd, so that'll be a week from Monday. At that time, Alabama is going to include all persons in Phase 1C. We are also going to include all persons age 55 and up. We're specifically going to add not only the high-risk medical conditions that we've reported to you before, but we are going to categorically include people with intellectual and developmental disabilities as well within that category. This will probably more than double the number of people in our state who are eligible for vaccine. We have chosen to do that based on a number of reasons. A lot of that has to do with the expectations of the public as they see other states doing that. And to some degree, it's just our anticipation of what we hope is going to be increase in vaccine supply. We still actually have very strong vaccine demand right now. I recognize there are a number of people in our currently eligible groups who are still having some difficulty finding vaccinations, and so I'm sure many of those folks are going to ask why would we expand at this time. But we do believe that it's the right time to do that. I think it's also important just to remind you that currently we're doing our 1A, 1B phases as well as persons 65 and up, and then it'll be Monday, March 22nd, when we add the full Phase 1C, which are certain critical workforce employees, people with high-risk medical conditions of any age, and then all persons age 55 and up. That will coincide, as you know, with the rollout of our National Guard in about 24 counties, or eventually will be in about 24 counties. We'll talk a little bit more about that. That'll be the week of the 22nd. The following week, which will be the week of the 29th, we are going to do some larger clinics around the state in at least one and perhaps more in each of our public health districts. We'll talk a little bit more about that as well, but we certainly anticipate there'll be an increased demand as we add eligible persons to the list. At the moment, we believe our numbers are still looking pretty good. Our hospitalization numbers are as good as they have been really since Memorial Day. We were down around 450 or so inpatients that were with confirmed diagnoses yesterday, which is still a lot of people, but so much better than we have had for much of the past 7 or 8 months. I wanted to give you a few updated numbers on vaccinations. We, as of today, as of last night, have administered about 1.2 million shots. The number actually is 1,214,816. That's 1,214,816. That represents over 760,000 individual Alabamians who've been vaccinated. It's difficult for us to stop and take time to get any perspective. This has been such a long, drawn-out response, but you know, it's actually tomorrow is the 1-year anniversary of the first case that we saw in Alabama. It was on Friday, March 13th, when we had our first diagnosed case, and I think it's worth considering how amazing it is that here, even just shy of 1 year, we've already vaccinated over 760,000 people here in our state with at least one shot, and that's an amazing amount of work done by an amazing group of people here and around the country and around the world. The vaccine response to COVID-19 is really going to be like landing on the moon was for some of us of a certain age. It's really going to be a remarkable thing that we'll remember for the rest of our lives. In terms of vaccine doses, we are now going to, we expect to receive somewhere between 110 and 120,000 first doses this coming week. So those allocations are creeping up a little bit. The majority of that is Pfizer. Pfizer's managed to increase its production capability a little faster than Moderna. We did receive Johnson & Johnson this past week. As you know, we were able, we pushed that out into our provider network and were able to add 131 providers. There were 131 additional providers in the state who got product with J&J. That represents about 49 pharmacies, 1 hospital, 6 community health centers, 57 provider offices, medical clinics, urgent cares, and so on, and a few others, but a total of 131 new sites. We, again, don't have any more guaranteed Johnson & Johnson for this week or the next 2 weeks, except that we were told we're going to get a small allocation of about 5,800 doses next week. There's a small amount that's being shipped out. So 5,800 is certainly a lot. Those are complete regimens that vaccinates 5,800 people, but certainly not a huge number in comparison, but we'll be very grateful to receive that. The announcement from the Federal Retail Pharmacy Program was that CVS here in Alabama would be adding 10 additional sites. That'll get them up to around 20 sites. Remember, this is a federal allotment. It doesn't come out of Alabama's state allotment. They use Pfizer vaccine. On top of that, there are about 66 Johnson & Johnson CVS sites who received Johnson & Johnson this past week. Some of those have already given their allotment. There are some that still have vaccine available, but those 66 will be out of product as soon as they give that one-time shipment until we're able to get more. But we will have 20 sites that are ongoing. We continue to have more than 120 Walmart pharmacies that are using the federal allocation as well. So, let's see. I wanted to mention to you that we continue to identify the UK variant in our state. We have right now around 71 cases that we know about. We suspect there are a lot more of those. We are doing testing using private labs and commercial labs, as well as what we send to the feds, but we're not doing large-scale testing at this point. And yet we found these 71 cases of this variant that we know is easier to spread. So we certainly have concerns that that is or will become the predominant strain, but fortunately our overall numbers are much better. We do have a really significant drop-off in testing, numbers of tests being done, which is true for every state in the country. Testing is an issue when it can go down because you don't have as many people seeking it because there aren't as many people with symptoms, and yet also many of the people who are involved in vaccination efforts are the same people who were responsible for doing all the testing, and so it becomes a resource issue when you just don't have enough staff to go around. So we're doing somewhere less than half of the testing we were doing even 2 months ago in Alabama. Again, some of that's reflected by the numbers, but some of that is just because of resources that are available to us. I mentioned a moment ago the National Guard clinics. Those are going to begin on the ground on March 23rd. We'll have 2 teams of 55 National Guardsmen and women who are going to be rotating through 24 counties. These counties are predominantly in the Black Belt and in the wiregrass parts of our state. The ADPH is working with the governor's office to do this. I know they're going to provide additional details on those locations once everything's finalized. But we really appreciate the support of the governor's office on that, and we really appreciate the support of the National Guard on that as well. General Gordon and her team have done a terrific job. We are working with county EMAs as well to help identify these locations, and the idea will be to have 1,000-shot clinics each day in a county, and then the next day move to an additional county. They'll be doing that 4 days a week. The 5th day will be sort of for logistics and data entry and so on. So there'll be each team will do 4 1,000-shot clinics each week. After 3 weeks of rotating from county to county, they'll go back and start the cycle again to begin giving second shots in those same counties in the same order, so that people will be on the 3-week schedule. It's the Pfizer vaccine, so that's why they're on a 3-week schedule. And the intent is to keep that going as long as we need to do that. It won't simply be 2 shots and then we're done. It'll be hopefully ongoing for weeks or months to come, and we certainly will determine whether we need to move those to other counties depending on how successful we are in reaching the ones that we're in. We are making a lot of effort around vaccine equity. We care very much about vaccinating the people who are most vulnerable. As you've heard me say many times, African Americans in our state are particularly vulnerable to being infected and more likely to die from this disease. That's certainly true nationally as well. We, as of this week, are able to say, very proud to say, that the top 9 counties in our state in terms of percentage of people vaccinated are all in the Black Belt, and 11 of the top 13 counties are our Black Belt counties. They are the ones where we have spent the most effort trying to make sure we have access to shots, and that's a very encouraging number for us to see. The National Guard clinics are going to continue to be in those areas. We know that transportation is an issue. We know there are a lot of access to care issues as well. Certainly there are vaccine hesitancy issues as well, which we can talk about, but that is not an issue that we have been able to manage real well yet because we've had such a demand. We've had so many people asking for shots. It's hard to determine what kind of resistance or hesitancy there might be. I will tell you that we are using a contract with a communications firm to try to assess vaccine hesitancy. There's been some polling done that we haven't completely released yet, but I can just give you an idea of it. In doing surveys around the state, trying to oversample for Black Alabamians to get a sense of vaccine hesitancy, but even looking at all populations, all races, we think we probably have about 30% of the state that's resistant to being vaccinated, for different reasons, and certainly some of those reasons are simply people who just need better information, and we need to find a way to educate them. Some of those are people that have other ideas about vaccinations in general, or about even the coronavirus event in general. So we'll be pushing out more information on that as we get that. That information is it's what we use to help design our communications plans and help us decide where we need to concentrate our efforts on trying to reach people who are most vulnerable. Our allocation plan, again, as we have told you before, is based on where eligible populations are. As we expand this list today, you're going to see all these groups of people are fairly evenly distributed around the state. So vaccine allocation becomes, more closely matched with just percent population. Bigger counties get more, smaller counties get less, except I will say that we are using our social vulnerability index to make sure that we prioritize those counties that are most vulnerable. So our top 10 or so counties, which are almost all in the Black Belt, are the ones that we are prioritizing in spite of the fact that they tend to be smaller in many cases, that they don't have as large a population, but we are prioritizing them first right off the top. And then with our remaining vaccine, that's how we are allocating that proportionally to the rest of the state. As of this morning, I think our updated numbers, let me give you this just to be sure I say it correctly. Actually, 15% of our vaccine has gone to African Americans in our state, about 54.6% to whites. We have about a quarter of cases for which we don't have race data. That's actually improved. Our team has done a really good job of trying to work through that. So around 25% we don't have race data for, but our percentage of African Americans is about 3 times the national average. Certainly not as high as we would like. African Americans make up about 27% of our state, so we certainly have some work to do to improve that number. I wanted to mention to you that the feds announced yesterday an expansion of the federal program for community health centers, or federally qualified health centers. Right now we have 2 sites in Alabama that are receiving a federal allocation. There are 12 more sites now that have been invited to participate in that. So this will be, in a sense, the same as the federal retail pharmacy program. This is just a different provider that's going to receive a different federal allotment. And FQHCs are very important in caring for underserved populations. As you know, they're distributed all over the state. They typically see low-income persons, and so we're very excited that we'll have this. This is an additional allotment that doesn't come out of our state allotment. So Let's see. I think that's all. I'll just stop right there. That's just some kind of basic introductory comments, but we'll be glad to answer any questions you have. Yeah.
The President talked about May 1st having all adults in the country able to get a vaccine. Will Alabama be able to meet that deadline?
We intend to. I watched the President last night, and I think that's a very ambitious goal, and we support it and want to make sure we can do that as well. He said specifically that he thinks states should expand eligibility to all adults by May 1st, and that there will be enough vaccine to do that by the end of May. So that's a little bit of a challenge to figure out, but yeah, absolutely, we will plan to do that as well, if not before, depending on what our vaccine supply allows us to do. Yeah.
Dr. Harris, have you had any meaningful reports, numbers of any allergic reactions, just in the state of Alabama, from everybody who's gotten the shot?
There have been a handful. You know, we I think maybe reported our first one the first week or so back in December when we were first given the vaccines, but we don't know of any fatalities. We don't have a higher rate than we would expect, and the numbers are very small. So.
Would you say less than 10?
Yes, I would. Mm-hmm. Yep. All right.
And the 700, and you just mentioned it earlier, the 760,000 people, shots or rather, are these, does that number represent just the first shot or 2 shots?
Yeah, that's the number of total people who've gotten shots, so I'll be glad to give you those numbers. We have the number of people who've received at least 1 shot are 765,724, 765,724. There are actually 459,000 who are completely done, 459,636. So just under 500,000 who've completed the series. So.
Dr. Harris, this is Brendan Turner from Fox 10 News in Mobile. I was wondering the balance between eligibility and vaccine supply, and if you're concerned that making so many more people eligible just means more competition for people who are truly vulnerable, versus people who are not as vulnerable, and how do you address that and prevent, make sure that the people who need it most are first in line?
Yeah, I mean that's exactly what we have concerns about. You know, the whole thing is attempting to strike a balance to make sure that we reach those people who are most at risk. We have, as you know, Alabama's followed ACIP guidance through CDC on how to do that, and risk is determined. There are a couple of different kinds of risk, as we've talked about before. There are people who are at high risk because of their age or physiology or underlying disease status, people who won't do well if they become infected. But then there are also people who are at risk just because of their risk of exposure, just because they're very likely to be infected or very likely to infect other people, even if they themselves aren't at high risk. So each one of our phases has tried to balance both of those types of risk. You know, so for example, in phase 1A, we looked at nursing home residents because they tend to be older with chronic health problems and in congregate settings, so they're high-risk individuals. But we also included healthcare workers, and you know, many healthcare workers are young, healthy adults in their 20s or 30s who aren't necessarily going to become ill themselves, but they're exposed to the disease a lot. They have the ability to expose other people inadvertently a lot. So we try to consider both factors. You know, similarly in phase 1B, we have people over age 75 that were included because they are at high risk for not doing well themselves, but we also included a number of occupations, you know, people like educators or frontline manufacturer workers, public transportation workers, and so on, because those people are exposed to large numbers of people every day and have the ability to infect a lot of other people or become infected themselves, even though they may themselves be a young, healthy person. So moving on to phase 1C is a similar kind of balance. You know, we're trying to include people that have certain chronic health conditions as well, because we know they're at increased risk for disease, and yet we're also adding these people who are critical workforce workers because they can become infected and they work in the public and may infect others. So there's no good solution to this. There have been some states that have only prioritized according to age and nothing else. You know, there have been some states that have only prioritized according to other factors, and there's very reasonable people who can disagree about the best way to do that. What we've tried to do in Alabama is just follow the federal guidance that we have and help people understand that your job title or even your age necessarily doesn't mean that you are at the front of the line. You're certainly eligible to get the vaccine if you fall into the category. No one's going to turn you away. But if you're somebody who can stay at home and socially distance and you're not around other people, you're probably not really at high risk, even though you may be a certain age or have a certain health problem. And if you're a healthcare worker, but you practice telemedicine and never leave your house, you probably aren't at high risk, and we would rather somebody else get in line in front of you. So there's it's just a difficult decision when there's not enough to go around.
And just as a quick follow-up, can you break down for us the distribution statistics based on by county? I don't know if I've seen that, but just curious as to the different distribution and take-up rates from county to county.
Distribution of vaccinations or distribution of population?
Of the vaccine. How many vaccines have been allotted and distributed and that sort of thing?
Yes, I don't have it with me. We can get it for you. That information is actually going to be posted publicly any minute. It may be Monday. We've been working on a way to have county level vaccination numbers, the way we do case numbers and all the other things that you see on our website. And it's been technically kind of challenging to do it. We have so many different people reporting from a county, and sometimes it's hard to tell, if it's where the person lives or where the person got the shot. But yeah, that number is we know what those numbers are, even though there are some problems with the data, and we'll have it public in the next couple of days at the latest.
Dr. Harris.
Yeah.
Collins, Fox 6. 1A, 1B, he told us was about 1.5 million. When you open it up to 1C, what are you talking about? And again, I assume your main word is going to be patient for people because they're now open. They won't be getting shots immediately.
Yeah. This is probably going to more than double the number of eligible people. I do have some numbers, and I'll be glad to give you the numbers. But you have to remember there's a lot of overlap among categories. Somebody can be 65 and also an essential worker, for example, or they could be more than one kind of essential worker in two different phases. And so, when we talk about adding people with chronic health conditions, for example, there's, certainly 7 figures worth of that in Alabama, and yet many of those people are employed in another job that they've already been eligible, or maybe they're a nursing home resident or so on. So I'll give you some of these numbers, but it's not a zero-sum game. There's a lot of overlap. Adding the category of people 55 to 64 is about 657,000 people in the state. Adding people that have chronic health problems, it's really difficult to know for sure, again, because you have so much overlap. But that number is somewhere around 1.8 million people. Alabama is not a healthy state at baseline. And so we do have a lot of morbidity from a lot of different things. When you look at the essential workers that are listed under Phase 1C, that's about 750,000 people, actually 775,000 people. So, if you add all those numbers up, you get more people almost than we have in the state of Alabama. So clearly there's a lot of overlap there.
Dr. Harris.
Yeah.
This is Tim Sandler, the Associated Press, and sorry I could not make it in person today.
Hey, good morning.
This is going to more than double the amount of people who are eligible in vaccine. I'm assuming that we are going to see more long lines, people swamping appointment lines, people having long waits for vaccines. What's the message to people regarding the patients needed as we do this?
Yeah, those are great points, and we have similar concerns, Kim. I would just encourage people to please remember to be patient. People have been patient for so long, and we're really very, very close to having enough vaccine to go around. I think in a month, probably 6 weeks at least, there's going to be a really more than adequate supply of vaccine. And the president said last night, by the end of May, there will literally be enough for everyone. So everyone who wants a shot is going to get a shot. It is going to be available for you, but it's not necessarily available today, but will be soon. I think the things that I find encouraging are just the fact that we can actually get vaccine out into so many more different places. We added, as I told you, 131 sites last week, just with Johnson & Johnson, we intend to keep those sites going as soon as we have adequate supply. The federal retail pharmacy program is adding additional chain pharmacies. The federal program for community health centers is adding, I mentioned, a dozen different sites. So ultimately, our vision in Alabama is that people will get their vaccine from wherever they would normally get their medical care. You know, there are certainly people that don't have access to care. The county health departments and others can step in to fill those gaps. But we don't want this to be, frankly, like some states have done and have achieved big numbers by having just a few giant clinics where people stand in line all day and night and come back and do it again 3 weeks later or 4 weeks later. That is a way to run our numbers up. It's not a great plan for vaccine equity because it tends to select those people that have cars and lots of time off and the ability to actually do that, who can travel and so on. Ultimately, we do believe people get the best care from wherever they normally get their care, and that's why we're trying to flesh out our provider network so that people can have a lot of choices about where they go.
On March 22nd, what is our supply situation going to be like? Is it still going to be around 120,000 doses a week, or do you think we'll be seeing an increase by then? It'll
be in that range. We've been seeing 2 or 3% increase each week, and so it may be a little bit more than that. We have a team dedicated to trying to look for unused doses or doses in which people haven't come back to take and so on, and so we're going to try to add to that pile. When we did our first set of mass clinics with the February 8th expansion, we had around 40,000 of Pfizer that we just used instead of sending that to the hospitals that week. We didn't have 40,000 extra doses, but we asked the hospitals to be willing to donate that. This time we don't really have we don't think it's the right thing to do to try to divert that from places where it's already being used. And so we're trying to put together different pools of vaccine that some we can hold out until then. Some of it is our inspected increase. So we are going to have clinics around the state in all these public health areas, as I mentioned, but they're not going to be quite the same scale. I think you're going to see several clinics of 1,000 shots or 2,000 shots as opposed to clinics that are given 5,000 shots. But we think there'll be more of them in more locations. So, it's a good point. We still don't have enough to go around. We recognize that's going to make the problem more acute with adding people to it. But I feel like it's still the right time to do that.
I have one final question
Yeah.
here.
Sure.
Going beyond the numbers, beyond the medical part of all this, what is the one overriding lesson that you've learned through this whole ordeal over the last 12 months?
It's hard to have perspective. We don't have time to reflect on that. I think the most important lesson is that science has given us the answer to solve this problem, and we always knew that it would. If you consider all the things that we've been through, we really haven't changed much about what we're telling people to do. In the past year, even there's been some new data on how long people have to quarantine, and the idea of masks when we figured out, well, they probably are more helpful because it's a droplet disease. It's not an airborne disease. Science has taught us a few things, but basically we're here a year later saying exactly what we said last March, which is please don't get together in groups. Please try to stay home if you can. Please, if you're sick, by all means, don't go around other people. The science has always had the answer to this, and yet clearly we've had a lot of challenges communicating that to people. People get their information in a lot of different ways, and people are in information bubbles, and sometimes the facts don't win the argument, or in fact usually the facts don't seem to win the argument. So I would just say the lesson is that science has always had the answers for us. It's how we deal with these kind of problems, and I hope next time we'll do a better job of helping people to understand the science on it.
Dr. Harris, the President last night did talk about July 4th. He hopes we're back to normal. Is that realistic? And what is your biggest, about meeting the May 1st deadline, that deadline, what is your biggest concerns for that could throw a monkey wrench into the matter?
Yeah, I think it's very realistic, but we've learned over and over again that we can't predict the future very well. things happen. The biggest concern I think everybody has is the emergence of new viral variants that spread much more quickly, or that the vaccine is not working for. And we don't know to what degree that's going to be a problem. It's definitely going to be some degree of problem. So our mission is to get people vaccinated as quickly as possible to get to something approaching herd immunity, so that we reduce community transmission of this disease, and then we don't have to worry so much about variants. So hopefully July 4th would be great. I hope we're able to get there.
Hey, Dr. Harris, Lauren Walsh with ABC 3340 News. Tell me if I had this right. You said about 110 to 120,000 doses this week would be the supply. I think I remember you saying 140,000 doses last week. So are we seeing a reduction, or am I misunderstanding?
No, you remember correctly. The difference was we had a one-time shipment of Johnson & Johnson last week of around, I think it was 60,000 doses or somewhere in that range. So that's what that total was last week. We're not expecting that this week or the next couple of weeks. So maybe the last week of March is when we think there will be additional Johnson & Johnson.
So are these numbers including the state's allocation and the federal allocation for Alabama?
No, those are the state's allocation. I think we were somewhere around 90,000 or something last week, plus around 60,000 Johnson & Johnson one time. This week we're over 100,000 state allocation, which doesn't include really any Johnson & Johnson. So the doses going through the federal allocations are not part of those numbers that I'm giving you.
Got it. Okay, and then also we saw new guidance from the CDC this week about fully vaccinated people being able to gather in small groups indoors. What's your guidance for people who have not been vaccinated yet, but they've already had COVID-19? Can they follow those same protocols?
We don't know that. The best information we have says that people who've been infected with COVID-19 within the last 90 days are not at very high risk for reinfection. And so I think that's important, and I think that gives you some degree of feeling good about things within 90 days or so. But clearly, people who have been infected previously can at some point become reinfected. At least some of them do. We have demonstrated that several times. It honestly doesn't happen a lot. I think immunity from natural infection probably is a lot longer than 3 months for most people, but we just don't know how to answer that question yet. So the guidance that CDC gave was about what vaccinated people can do. It wasn't about what unvaccinated people can do, whether they've been infected or not.
Thank you. And when we're talking about the National Guard clinics, can you elaborate on the goal of the National Guard clinics, and also do you know which counties they might start in?
Yes, I think we do have that. They're still working out the details, but I know the governor's office has told us that they're going to announce all those sites very soon, and I don't want to get ahead of them. I honestly don't even have it with me, but the goal of those is to go to our higher SVI counties and be mobile in a way that we can reach people who may have a hard time getting to a clinic otherwise. So these are counties where we know people are most at risk, and many times that's because they have other social determinants that make it difficult to achieve a vaccination. They don't have good access to care. Maybe they're low income. Maybe they're not as medically literate and able to chase down how to get a vaccine. Maybe they don't have internet access to look for things, or they have transportation issues. So those are all problems that we have in many parts of Alabama. And so in those most vulnerable counties, that's where we want the Guard to be, trying to reach the people who aren't able to access vaccination otherwise.
Great. And my last question for you, you said adding 10 more CVS sites. Do you know how many doses they may be getting and where those new stores may be? And can you also just talk more about adding the CVS stores, expanding the federal retail pharmacy program, what it means in terms of getting Alabama vaccinated? Sure.
I'll say to begin with, we're very excited that they're able to do that. In terms of the locations, I'll give you the locations that I have here in just a minute. I don't have the dose numbers here. I think they got somewhere, last time they got somewhere around
just over 11,000. They're going to get a similar allocation. They got over just 11,000 the first round. They're going to get a similar allocation.
Okay, thanks. Jamie Durham says that they got a little over 11,000 allocation initially, and that's what we expect to get for this expansion. Is that in addition to the 11,000
Yes,
you're saying?
sir.
Yeah,
That's
it's so in addition. So about 11,000 more for the expansion. The counties are where they're going to be located that I have here are Autauga, Calhoun, Etowah, Jefferson, Lee, Mobile, Montgomery, Morgan, and Russell. So we're actually very excited about that. That's remember, additional federal vaccine that does not come out of Alabama's stockpile. It just increases the number of locations that people have available to them. Remember, for the retail pharmacy program, go to the websites of places like CVS or Walmart to make your appointment there. Those are great locations to have, and just make it a little bit easier for Alabamians to find a shot.
And just for clarity, the 11,000 number, is that 11,000 across the 10 new stores, and is that a combination of first and second doses?
Let me see.
So that's going to be their first doses. They'll get some follow-up doses of that too. So it's a consistent allocation.
Okay.
We'll get the true numbers for them, what they're coming.
Our understanding on that is that is the number of first doses, and that 11,000 is the amount that's going to supply these 10 new stores. So sounds to me like that's one Pfizer tray each. I'm not sure if that's exactly right, but that sounds like what that works out to. We'll try to get some more details on that and put it out there, but we believe that it's 11,000 divided over 10 new stores.
And that will be their
And that'll be first doses. Yeah.
And those stores will start giving those this week?
I think actually, it should be this weekend, or there's been a delay last I heard, so it might be first of next week.
Either this weekend or first of next week is our understanding.
Great, thank you so much.
Thank you. Okay.
Dr. Harris, this is Kim Chandler at the Associated Press again.
Yeah.
Can you discuss the balance of people who are at risk for exposure and people who are at risk for COVID complications? I hear a lot, I'm sure y'all do as well, that is it fair for a healthy 22-year-old grocery worker to be eligible for the vaccine the same time as a 55-year-old cancer patient who still has to go to work every day? Can you discuss that kind of balance that health officials are faced with? Sure.
I mean, it's a very difficult decision, and I'll tell you, there's no, I'm sorry, I'm having trouble speaking. Irrefutable logic that's going to convince people if they believe what they believe. It's an attempt to strike a balance when there's not enough to go around. It's very difficult decisions. We don't make them lightly, and we, agonize over the people who, very much want to get the vaccine but who aren't able to get it yet. Of course, everybody in Alabama deserves to be vaccinated. We feel compassion for people who are wondering how long they're going to have to wait, and we want all of them to have it. But it is an attempt to recognize that we have to protect our most vulnerable people. At the same time, we also have to make sure society continues to function. And when we have people like, a grocery worker who may not himself or herself be at risk for serious illness, but who may be around hundreds of people a day, all day long, it's a calculation, and every one of those calculations has pluses and minuses, and not everyone's going to be happy with those decisions.
And when do you think the vaccine supply will dramatically increase in the state? And what do you mean by that? In about a month or so, how many doses a week should we be getting?
Yeah, I don't think we know for sure what the number is going to look like, but we're sort of basing that off what the feds have told us about expected increases, particularly in Pfizer production. But then maybe we'll begin to see increased J&J product. As you know, J&J is partnering with Merck to increase. Anyway, they're with a goal of reaching 100 million doses by June. We think we'll begin to start seeing some of that in April. If they were able to do that, well, that would be tremendous. For every million doses produced in the stockpile that's made available to states, Alabama gets around 15 or 16,000 of those doses. So Having 100 million Johnson & Johnson doses would be a tremendous boon to us here.
If you said this is going to roughly double the number of eligible people.
That's the best.
Is that correct?
Yeah, that's our best calculation. And again, it's difficult because of the overlap among categories to really give you a hard and fast number on that. But we believe that's about right.
Thank you.
Dr. Harris, this is Jaish Patel with NBC 15 in Mobile. Recently, a Utah mom died 4 days after she got her second dose of the Moderna vaccine. This has caused some vaccine hesitancy. Do you have a message for anyone that may be feeling hesitant now?
Well, these vaccines are safe and effective, and we certainly understand that there have been reports in the media of people who died after receiving a shot. I would say statistically that's something that's going to happen. In the U.S. now we've given around 64 million vaccinations. Those people receiving those vaccinations have been disproportionately older or people with chronic health problems, and when you look at a population of millions and millions of Americans who are older with health problems, there are going to be some unfortunate events that are kind of correlated, but we believe, based on the best science we have and the information from the phase 3 trials that were done, that these vaccines are safe and effective. Just like any vaccine or medicine or medical treatment, it's a discussion that people ought to have with their medical provider if they can do that. There are certainly some people who shouldn't take an mRNA vaccine, for example. There are, but by and large, these are very safe vaccines, and we, are continuing to monitor very closely any reports of adverse effects. CDC tracks all of those to make sure that there aren't any problems that haven't been identified yet.
Thank you.
Okay. Anybody have anything else? If I could just throw in one last thing, you reminded me of something there, but I do want to, again, remind people that we believe all three of these vaccines are safe and effective and equivalent, not interchangeable, but equivalent. We certainly understand that there's a narrative out there about Johnson & Johnson somehow being less effective. I would just want to remind you, it prevents serious illness and prevents hospitalization and prevents death exactly the same as the other vaccines. In fact, in their large phase 3 trial, there were no deaths among anyone who received the Johnson & Johnson vaccine. We believe that it is completely equivalent and would encourage people not to go vaccine shopping. Please take the shot that's available to you. There's not enough to go around to put one off and wait and expect to find one later. We're going to still be short for a while, so if you have the opportunity to take a vaccine, please take it. Unless there's a medical reason that you shouldn't take one vaccine or another as determined by your provider, please take the vaccine that's offered to you.
Okay.
Yeah.
On that, what you just said there, I believe there was an article in maybe the Wall Street Journal this week that explained the number that we see, the 95% efficacy rate, is not the same as how, quote unquote, effective it really is. Isn't that kind of?
Yeah, and I think that's the point. We want people not to get sick, and we want people not to die. and by using those measurements, these vaccines are all identical. So please take the one that's offered to you.
Dr. Harris, this is Alan again. Could you go over the numbers again for the National Guard starting on March 22nd, the number, teams, and are the sites selected for the mass vaccination sites on March 29th at those areas?
Sure. The National Guard teams, there will be 2 teams. Each team will have about 55 members of the team. Each team will be trying to give at least 1,000 shots a day, and each team will be working 4 days a week, moving from one county to the next over a 4-day period each week. They'll have a total of 12 counties that they're covering, so they'll do 4 counties each week, 4 different counties each week for 3 weeks, and then go back and start the same cycle over to give second shots 3 weeks later, since they're using Pfizer vaccine. In terms of the sites, the next week, those are sites that we're working out with our public health districts around the state. We've had a number of calls working with them and are reaching out to partners like EMAs or perhaps some other providers that can help us with those. So we don't have those locations yet, but we will have them very soon.
Thank you.
Dr. Harris, those National Guard sites, will those be appointment only or walk-up?
So right now, there are walk-up drive-throughs at this
Yeah.
point.
At this time, they're intended to be walk-up, drive-through, walk-up, not appointment only. If that changes, I'll let you know, but that's our plan at the moment.
Will appointments be available for them at all?
Not at this point in space, right now, because we're going to the rural communities where we have not opened up appointments yet.
Okay. No, not at this time. Okay. All right. Well, listen, thank you all very much. We appreciate you joining us, and happy to keep doing these as long as you find them helpful. Thank you.
Thank you, Dr. Harris.
Okay. All right.